Dentistry in India is going in a very wrong direction. In the past 7 years, almost 60% of the work that I've done in my clinic is redos of work that has been done somewhere else. I have seen perfectly good anterior teeth that just require some minimal orthodontic work being ground down to look like traffic cones and being restored with over-contoured splintered crowns. These teeth have also been root canal treated so that the patient doesn't come back complaining of sensitivity. Why? Because the crowns themselves have margins that are a mile away from the finish line. This is just an example, and I can keep going. Patients have been promised Straumann implants and have been given Adin implants. Patients have been promised zirconia crowns and have been given PFM crowns. Alarmingly, this is not work being done by some obscure quack sitting in some remote village. This is work being proudly displayed on the social media accounts of dentists who have tens and thousands of followers. Dentists who unfortunately are looked up to as role models by young dentists. These young dentists then in turn go and commit the same mistakes in their own clinic without even realizing the mistakes that they are committing. This social media influence has become so bad that new dental clinics are going hunting around for high value unicorn treatments such as aligners and implants without focusing on delivering high quality bread and butter dentistry. Obviously, everyday bread and butter dentistry is neither glamorous nor is it as Instagrammable as being called the adamantium service provider of a certain aligner brand. As a result, we have multiple young dentists getting frustrated with the profession and quitting private practice because what is reality is neither as glamorous nor as lucrative as what is shown online. Of course, the real victims of this trend are the general public. However, they are also not free of blame. Even a cursory research on Google Search Console will show you the most searched terms in relation to dentistry in any area are cheap dental treatment, free dental implant, cheapest dental implant in my area, and etc. This has forced new dental clinics to participate in a doomed race to the bottom where clinical standards are being compromised to fit the treatment plan to an unrealistic budget set by the patient. A patient who in almost all cases is clueless about the harm that they are doing to themselves. The oral cavity is one of the most hostile environments in our body, especially to any artificial restoration or replacement that is done there. When clinical standards are being compromised, restorations and replacements that are supposed to last for years and years, probably in best case scenario, will fail within a year or two. In the worst case scenario, they are probably going to take a few teeth along with them when they fail. The end result is these patients then end up with someone like me and with a clinical bill that is 3 or 4 times what they would have probably paid if the treatment was done properly. That said, as long as patients are choosing their dentists based on how much they charge and how many followers they have on Instagram, they are doomed to commit the same mistake again and again.